Hello, everyone. Welcome to this episode of Dr. Cage Says. Today I'm talking about fibromyalgia and the possibility you may have been misdiagnosed and mistreated somewhere along the way. So let's get into this very important material. In my experience, it's important for you to know that fibromyalgia actually has a very specific medical definition, which unfortunately is very frequently misused. All too often, any form of muscular pain or joint pain is written off as fibromyalgia when in fact it may not be true. If that happens, this will delay proper treatment if the pain is due to something else, and unfortunately, it also delays proper treatment if the pain is due to fibromyalgia, because in the world of conventional medicine, there is no known cause and therefore no effective long-term treatments for fibromyalgia. So with that short introduction, you're probably asking yourself, well then, what is fibromyalgia? The name fibromyalgia literally means fibrous, achy muscles. This is a pain syndrome of the soft tissues, muscles and tendons primarily. Any pain inside a joint capsule is simply not fibromyalgia. It might be in the arthritis family, such as rheumatoid arthritis or osteoarthritis, or might be due to some other joint injury, such as torn ligaments, torn cartilage from an injury, but it's not fibromyalgia if the pain is inside the joint. That's the first point that is often misused, where fibromyalgia is misused. Furthermore, it's not pain just any old place in the muscles. The pain in fibromyalgia involves pain at very specific locations in the body, near joints, and also at something called trigger points. So here are the fibromyalgia trigger points. They are bilateral, meaning the same point on each side of the body, and you see them numbered there. 1 and 2 are a pair, 3 and 4 a pair, 5 and 6 a pair, and so on the front and the back of the body. And there's 18 points total. And the way we assess fibromyalgia, unfortunately, is we have to cause the patient a little bit of pain. We will palpate those trigger points and observe your response, which is going to vary from, no, that doesn't hurt at all, to what is sometimes called the chandelier sign, where the patient leaps off the table and you find them clinging to the chandelier because even a light touch caused that much pain. Now, what's interesting, and is part of the true definition of the cause of fibromyalgia, is that these trigger points lie on what Oriental medicine calls acupuncture points. Now, the medical world has come up with formal diagnostic criteria, which means you need to have pain on palpation at least 11 of the 18 trigger points. There needs to be a history of widespread pain for at least 3 months. Widespread is defined as continuous pain on both sides of the body, above and below the waist, and in the spine. There are actually some problems with those very specific and rigid criteria. First, the number of trigger points selected, 11 out of the 18, is very arbitrary. There is no physiological basis for that number having been selected. So if every other criteria is met and the person only has pain on 10 of the 18 trigger points, the conventional world will say, no, you don't have fibromyalgia, and therefore you will not be treated appropriately. The duration of pain can vary. Over the years, I've seen many patients who maybe they only have pain for a month or 2.5 months, which relapse and remits. I've seen pain get worse during certain weather conditions, go away almost entirely under other weather conditions. And so those patients didn't fit the formal criteria, but they do respond to the treatment I'll be outlining here in just a few moments. Maybe they don't have pain on one side, or maybe below the waist, and that means they don't fit the formal criteria, but all of these variations can be presentations of the same phenomena. So just what is that phenomenon that all these different symptom categories can be variations of? Well, you see it on the screen. Toxic heavy metals seem to be the missing link. In my practice, 100% of the fibromyalgia patients I have tested were positive for heavy metal toxicities in the body. The most common ones I found in fibromyalgia cases are mercury, lead, aluminum, and nickel. There could be others also present or instead of these big four. And the only acceptable method for testing of heavy metals is a provoked urine test. You start with a 24-hour urine collection as a baseline. The patient is given a provoking dose of one of the chelation medications, preferably intravenously or via one of the other routes, followed immediately by a second 24-hour urine collection, and metal content is then compared between the baseline and the provoked test. It's important to note hair analysis will not reveal heavy metals stored in the tissues, which are the very specific cause of fibromyalgia. Blood testing is only accurate for acute heavy metal poisoning, which means within the last 60 to 90 days following an acute exposure. Here is an example of the baseline before provocation and the post-provocation heavy metal test from an actual fibromyalgia patient. And you notice that here's the list of metals in the test. And as you go down the list, there was no aluminum at baseline and highly elevated at provocation. Antimony showed up. Arsenic, really no change, not much change. That means that is not an old exposure, but it's an ongoing current exposure. Cadmium showed up, it wasn't there at baseline. Lead, look at that, almost off the charts high, barely present at baseline. That is an old exposure that has accumulated in the tissues. Same for mercury. Nickel, an ongoing exposure, a little bit in the tissues. Thallium went down. That means there's very little in the tissues, and it's being cleared even with just the one provoking dose involved in the test. You see tungsten, pretty much an ongoing baseline thing. Uranium, this individual was exposed to uranium perhaps by being downwind of a nuclear reactor at some point. So these are the kind of results that you can use to determine, is this an acute exposure, is it chronic in the tissues, and how do we do with that? What do we do with that in the future? The next thing we need to discuss is the 90% female predominance of fibromyalgia. Why is that the case? There's been no hormonal explanations ever given in the conventional literature. But here is one that is mainly an Oriental medical explanation. The liver is our body's primary detoxification organ, and the liver is responsible also for clearing excess hormones. The additional burden of clearing hormones each month as women go through their menstrual cycles, plus metals, can simply overload the liver. An overloaded liver becomes inefficient, which in the terms of Oriental medicine, the liver is responsible for circulating qi throughout the body, and an overloaded liver can cause qi stagnation, which results in pain. Any kind of stagnation or excess in Oriental medical theory is what causes pain. It is important to note that most of the trigger points are located on the yang meridians, which is a masculine energy. Yin and yang. Yin is feminine, yang is masculine. There are many other distinctions between yin and yang, but all but one pair of these trigger points are located on yang meridians. So men, you give them an excess of yang energy, they're not going to notice. They might even say they feel a little better because men are yang by nature. Women who are predominantly yin are going to be more easily damaged by yang excess, which is their opposite polarity. And this, in my experience, is what causes this heavy female predominance in fibromyalgia sufferers. In the world of natural medicine, we do in fact have effective treatments for fibromyalgia. The ones I'm going to list here are all symptomatic control. The relief they will provide is only temporary because the long-term approach is we have to clear the heavy metals from the body. So the holistic natural approach, we use a combination of things. Intravenous vitamins and minerals, such as the famous Myers cocktail, homeopathic trigger point injections, constitutional hydrotherapy, which is the use of hot and cold water to stimulate the body's inherent healing systems, a hot pack called a castor oil pack. Acupuncture can provide symptomatic relief. Iodine deficiency is actually the second root cause of fibromyalgia, and most fibromyalgia sufferers are in fact deficient in iodine. And any of the natural pain control supplements for pain or inflammation can be effective with far, far, far fewer side effects than conventional drugs. Now, every patient doesn't need all of these, and the exact combination used will depend on the particulars of each and every case. And as I just mentioned, the permanent healing from fibromyalgia requires heavy metal chelation. For those who may not be familiar with the term chelation, it comes from the Latin, or maybe it's the Greek word for crab. And chelation medications were developed during World War II when suddenly very large numbers of the population were being exposed to heavy metals from war, and they needed to treat that. So heavy metal chelation, the medications involved have a binding affinity to collect heavy metals that's more than 100 times stronger than any known natural substance. Chelation medications in general are very safe with few side effects when used appropriately. They can be delivered intravenously, which is the most effective, and other routes such as oral, rectal suppositories, or topical creams are also available. Oral chelation is the least effective. There's only about 15% of that medication that will be absorbed from your GI tract into the bloodstream. Intravenous is the most effective. All of the medicine makes it into the bloodstream. Rectal and topical use, about 80 to 85% absorbed. So if there's some contraindication for IVs, then we do have other options. The duration of treatment can be relatively long. About 25% of people are cleared in 6 months or less. Another 50% in that 6 to 12 months category, and the remaining 25% will probably need more than a year for the follow-up provoked urine test to show that you're normal and all the metals have been cleared. So that is the short, quick overview of fibromyalgia. I hope you find it useful. Over on my website, drcagesays.org, I have a whole lot of information about all aspects of health. My classic book, Heal Your Life, Heal the World. The core lectures, I have a free video on the core lectures. The core lectures are a lot of the information that I've used to help patients over the years without ever getting to treating their actual illness. Those are available through membership in my Patreon hosted Dr. Cage Says health plans. And I do in fact have a much longer video on fibromyalgia available in the Patreon program. If you have questions about fibromyalgia or any of my other offerings you find on the website, my email address is here on the screen, drcagesays@gmail.com. Good health, and I hope to have you tuning back in the future. And if you have questions, yes, by all means, contact me. Thanks for watching, and I hope to see you or talk to you again in the future.